So I'm checking Mr. Larry Angio's order. So the doctor ordered him like a tracheostomy suction PRN every 8 hours as needed. And then he also have the tracheostomy care. So I prepare things to his room. Checking outside of the room, there's no precaution. So I don't have to wear my PPE. I wash my hand and knock knock. Hi, this is Shirley. I'm your nurse today. How are you doing?
Good.
Okay. So can I check your wristband to see your first and last name and your date of birth?
Yep.
Okay, Mr. Larry Angio, 49 years old, which is the right patient. And then my name's Shirley. And then the doctor orders you for the suction in your tracheostomy. And then we're doing the dressing change, okay? So first of all, let me ask you, do you have any pain?
Nope.
No pain, so we don't need any pain medication. And then is there any concern? Just let me know, okay?
Okay.
Do you have any allergy?
Nope.
No allergy, okay. All right, so let me check on your order. I'm looking at the MAR. So making sure I have the right stuff. So 14 French suction catheter. So this is the right one. And a tracheostomy care kit, okay. Then I'm going to perform a hand hygiene. So Mr. Shio, then I'm going to check your vital signs first, okay? I'm going to put my clean gloves on. So if you have anything to say, just raise your hand, okay? And put on a blood pressure cuff to monitor the blood pressure and the oximetry on the finger to see his O2 set and also his the heart rate. So now the patient is on the normal blood pressure, normal heart rate, and oxygen level is okay. So now I'm going to assess your lung sounds first, okay? Can you take a deep breath? Another deep breath. All right. Okay. Good. All right. So let me put you on a comfortable position for me to work. And then I'm going to put you on, sit you up a little bit, okay? All right, let me know if it's in a comfortable position, okay? Okay, all right. Now I'm going to do the suction. I'm going to hyperoxygenate you, okay? Okay, can you flex your head a little bit? Okay. So now I'm going to hyperoxygenate Mr. Gio so that he won't out of oxygen during my suction. So I'm monitoring his oximetry. The oxygen level is around 100%, so which is great for him. Okay. Then I'm going to check the suction. So suction open to continuous suction 80 to 120, and then it works. And I'm going to put it over here, ready to use. All right, so let's get started. I'm going to organize my table. the towel on you first, and then wipe down my table with the antimicrobial. Okay. Put my gloves off. And then perform hand hygiene. So the surface is already dry. Then I'm going to take out my kit. I peel this one out. All the way. And then I have my cup. Get it ready. Put it over here. Put it over here. Okay. Then this is the gel. Put some gel over here because it's sterilized. Get it out of the way. And this is the normal saline. Pour some normal saline over here. Okay, then I'm going to put my sterilized gloves. Are you feeling okay?
Yep.
Okay. Okay. Pinch
Bracket.
and scoop
Make sure I have one coming out. Now we're gonna break arrow field with my
and scoop. Alrighty. So I'm going to take this one out. The suction thing. Okay. Wow. Like this. Alright. Then I'm going to use this hand. Tuck it. Stay away from this. And then see it's working. Then I'm going to sip some of the normal saline. It works. Okay. All right, Mr. Gio. Then I'm going to put the tube on into your catheter and suction the mucus out. Okay. All right. So I'm going to insert it out. When I hit the resistance, then I draw back for like half an inch, and then in the suction. Twisting out, no more than 10 seconds. Okay, so it's all clear. So I'm going to take this one out. Do you feel better?
Yep.
Yeah? Okay. Then we don't need the second round of suction. So I just get these things out of the way. Perform hand hygiene. Do you feel better, Mr. Gio?
Yep.
Okay. Let me put on clean gloves. Then I'm going to listen to your lung sound again, okay? actually now I'm doing the suction. Before I'm doing the suction, I put my mask and put my goggles and PPE on just in case Mr. and Gio sneeze or coughing out. Okay, let me listen to your lung sound. Can you take a deep breath? Good. Alright, so his lung sound is already clear. And then I'm checking his oximetry again. So the oxygen level that didn't drop too much. It's still on the like normal range. And heart rate didn't change. Blood pressure is almost the same, which means that he's tolerate this well. Do you have any pain during the procedure?
Nope.
No. All right. Thank you. Then we're going to. I'll have you rest for a while, and then we're doing the dressing change. Okay?
Okay.
All right. Thank you. I put off my gloves. And hand hygiene again. And then I'm going to clean up everything just for a moment. New towel. All right. So I'm going to wash my hand again. Yeah, I'm going to put a clean towel on you. Clean gloves. Then now I'm going to put your old dressing out, okay? So I'm going to put the old dressing out to see if there's any drainage. So the old dressing is intact, clean and dry, so no any drainage. I just drop it out. Then I'm going to inspect the skin underneath. So there's no sign of infection, no redness, no drainage, which is great for him. Okay, then I'm going to clean my table again. Make sure it's all clean. Okay. Wash my hand. So the table is already dry. Wash your hand again. And then I'm going to bring my kids over here. Peel it open like this. Put it over here. Then I'm going to pour out the drape, just touching the 1-inch border, shiny side down. There. Then I'm going to pour everything out. Okay. Normal saline into 3 basins. Okay. Anything else? Nope. Okay. Wash my hand again. Then I'm going to put my sterilized gloves on. Put it out of the way. this one get out of the way. I'm going to organize things over here. Brush, and then the stripes. This one, 4x4. Okay, then I'm going to move this one closer to me. Okay, then I'm going to use one hand, twist, and slowly take the inner cannula out, and then inspect there's no bloody thing. Then I'm going to drop it in the first basin, the rings, and then use my sterilized hand, and then I'm going to brush it inside. Brush, all the way, and then outside, then drop it, and then put it to the second basin. Rings, and then use this sterilized Q-tip to dry it out. Drying all the way, and then dry inside, dry the outside. Okay, then I'm going to put it back slowly. And twist and lock it. Okay. And then now I'm going to clean the periskin of the tracheostomy. So on the third basin, dip some clean normal saline, sterilized normal saline. And then clean inside out like this. Inside out, and then these things. Okay. Then I grab a 4x4 to pat dry. All right, it's already dry. Then I'm going to get one of the fenestrating dressing, slice into the tracheostomy periskin. Make sure so there's no skin breakdown. I have already checked it, so the patient is okay. No signs of infection, no drainage. Skins are intact and clean. Okay. All right. So the last step is just to change the stripe, stripe. Then I'm going to slide this one in. Double it, and then around the patient's neck. And at this time, I'm going to check all the way at his back and the skin to see if there is any breakdown. So Mr. Laryngeal doesn't have any skin breakdown behind the neck, which is great. And then I'm going to put this one back and then tie it. Okay. And tie it. Okay. Just enough to secure, not too tight. And then get the old one out. Get this old one out. Okay. I'm going to get it out. All right. New dressing. So, are you okay? Do you have any pain? Nope. No pain. All right. Thank you. So, you're all set. I'm going to take those things out and then clean up. So, I'm going to put you on your lowest position. And this is the call light within your reach. Then just let me know and call me, hit the call light button if you have anything, okay? Is this a comfortable position on you? Okay, yeah? All right, thank you. And I'm going to put my gloves off. Hand hygiene. And then I'm going to clean up the tables, clean up his room, and then document what I have done.